CNA Multiple Choice Questions, 2026. Question 1. The leader of the healthcare team is the A. Dr. B. Registered nurse, RN, C. Advanced practice nurse, D. Person receiving care. The correct answer is person receiving care. Modern healthcare is patient-centered, making the person receiving care the most important member and leader of their own care team. Question 2. Which action is a nurse assistant's responsibility? A. Administering medications. B. Communicating verbal orders related to the person's medical care to the nurse. C. Assisting people with activities of daily living, ADLS. D. Analyzing and interpreting data. The correct answer is assisting people with activities of daily living, ADLS. The primary role of a CNA is to provide basic care and assist with ADLS. Medication administration and data analysis are typically the responsibility of nurses. Question 3. Which of these is not one of the 6 principles of care? A. Safety. B. Privacy. C. Impartiality. D. Communication. The correct answer is impartiality. The 6 common principles of care are safety, infection control, dignity, independence, privacy, and communication. Question 4. Empathy is the quality of A. Acting in a way to gain the trust of others. B. Pitching into work as part of a team. C. Recognizing another person's hardship, accompanied by a desire to help relieve that hardship. D. Seeking to understand another person's situation, point of view, or feelings. The correct answer is seeking to understand another person's situation, point of view, or feelings. Empathy involves the ability to understand and share the feelings of another person. Question 5. When you treat someone with respect, you are applying which principle of care? A. Infection control. B. Dignity. C. Independence. D. Safety. The correct answer is dignity. Dignity is the principle of treating people with respect and valuing them as individuals. Question 6. The goal of the healthcare team is to A. Minimize healthcare costs by spreading the workload over many people. B. Make sure the person is sent home from the facility as soon as possible. C. Provide personalized quality care that meets the person's physical, emotional, social, and spiritual needs. D. Make decisions on behalf of the person receiving care. The correct answer is provide personalized quality care that meets the person's physical, emotional, social, and spiritual needs. The goal is holistic care that addresses all aspects of the patient's well-being. Question 7. Which of the following statements about delegation is true? A. It is outside the nurse assistant's scope of practice to decline to do a delegated task. B. When one person delegates a task to another, that person gives the other person the authority and the responsibility to complete the task on their behalf. C. The nurse assistants may delegate tasks to other members of the healthcare team. D. All of the above. The correct answer is when one person delegates a task to another, that person gives the other person the authority and the responsibility to complete the task on their behalf. Delegation involves transferring the authority to perform a selected nursing task in a selected situation. Question 8. Where is care provided for a person who requires treatment for a sudden injury or illness? A. Subacute care setting. B. Home setting. C. Acute care setting. D. Long-term care setting. The correct answer is acute care setting. Acute care settings, like hospitals, are designed for short-term treatment of severe injuries or illnesses. Question 9. Mr. Bowler is 85 years old. He has dementia and requires close supervision and help with ADLS. What healthcare setting would provide the most appropriate care? A. Acute care setting. B. A nursing home setting. C. A hospital setting. D. Subacute care setting. The correct answer is nursing home setting. Nursing homes, long-term care facilities, provide 24-hour supervision and assistance for those with chronic conditions like dementia. Question 10. Mr. Johnson was admitted to the hospital for pneumonia and was hospitalized for 4 days. What word best describes Mr. Johnson? A. Outpatient. B. Resident. C. Inpatient. D. Client. The correct answer is inpatient. An inpatient is someone admitted to a hospital for at least one overnight stay. Question 11. Which legislation establishes quality standards for the care of residents of nursing homes? A. Ombudsman Act, OA. B. Occupational Safety and Health Administration, OSHA. C. Omnibus Budget Reconciliation Act, OBRA. D. Resident Rights Act, RRA. The correct answer is Omnibus Budget Reconciliation Act, OBRA. OBRA 87 set federal standards for nursing home care, including training requirements and resident rights. Question 12. Which of the following is a basic right of people who are receiving health care? A. The right not to pay. B. The right to competent care that is delivered with respect. C. The right to abuse healthcare workers. D. All of the above. The correct answer is the right to competent care that is delivered with respect. Patients have the right to receive considerate, respectful, and competent care. Question 13. A resident falls because a nurse assistant failed to place the call light within reach. This is an example of A. Larceny. B. HIPAA violation. C. Negligence. D. Abuse. The correct answer is negligence. Negligence is the failure to provide the expected standard of care, resulting in unintended harm. Question 14. You suspect that Mrs. Jellison is being abused by her son. What should you do? A. Call the police immediately. B. Confront the son and tell him to stop. C. Report your concerns to your supervisor at the agency. D. Nothing, this is a private family matter. The correct answer is report your concerns to your supervisor at the agency. CNAs are mandatory reporters and must report suspicions to their supervisor immediately. Question 15. Which legislation supports a patient's resident's or client's right to make decisions on their own behalf? A. HIPAA. B. Advance Directive Act. C. Patient Self-Determination Act. D. Patient Autonomy Act. The correct answer is Patient Self-Determination Act. The Patient Self-Determination Act requires providers to inform patients of their right to make healthcare decisions. Question 16. Which action supports a person's legal rights under HIPAA? A. A nurse assistant declines a resident's request for health information about another resident. B. A hospital stops documenting patient care on paper records. C. A nursing home has a policy that says all residents will receive equal treatment. D. A nurse obtains informed consent from a person. The correct answer is a nurse assistant declines a resident's request for health information about another resident. HIPAA protects patient privacy. Sharing information about other residents is a violation. Question 17. 13-year-old Kathy Harrison does not want to see friends because of stitches on her face. She is worrying that A. She will have to tell her friends that she cannot leave the house. B. Her friends will think she is ugly. C. Her mother won't let them come over. D. Her friends will bring her schoolwork. The correct answer is her friends will think she is ugly. Adolescents are often highly concerned with body image and peer acceptance. Question 18. A nurse assistant helps Mrs. Smith meet her love and belonging needs by A. Ensuring Mrs. Smith has enough to eat. B. Helping Mrs. Smith get ready to attend a group activity. C. Encouraging Mrs. Smith to do as much for herself as possible. D. Making sure that Mrs. Smith feels safe and secure. The correct answer is helping Mrs. Smith get ready to attend a group activity. Social interaction and group activities help fulfill the human need for belonging. Question 19. Mr. Jameson always talks about the past but not the present. You should A. Tell him not to dwell on the past. B. Tell him how interesting it must have been in those days and ask him some questions about it. C. Change the subject. D. Remind Mr. Jameson that he is retired now. The correct answer is tell him how interesting it must have been in those days and ask him some questions about it. Reminiscence is therapeutic, validating his past experiences supports his self-esteem. Question 20. A nurse assistant helps a female resident meet self-esteem needs in all of the following ways except A. Addressing her in the way she prefers to be addressed. B. Doing everything for her so that she does not have to do anything. C. Taking care to protect her privacy and modesty. D. Taking an interest in the resident as an individual. The correct answer is doing everything for her so that she does not have to do anything. Doing everything for a resident reduces their independence and can lower their self-esteem. Question 21. Sexuality is A. The physical act of having sexual intercourse. B. The ability to form intimate relationships with others. C. How people perceive themselves and express themselves sexually. D. Knowing whether you are a girl or a boy. The correct answer is how people perceive themselves and express themselves sexually. Sexuality is a broad concept involving gender identity, sexual orientation, and self-expression. Question 22. How should the nurse assistant handle caring for people from different cultures? A. Advise people they must follow facility policies. B. Seek to understand each person as an individual, accommodating preferences whenever possible. C. Use own personal cultural beliefs to guide care. D. Avoid caring for people from a different culture. The correct answer is seek to understand each person as an individual, accommodating preferences whenever possible. Culturally competent care involves respecting and accommodating individual beliefs. Question 23. Which statement about older adults is true? A. Older adults are not capable of learning new skills. B. Older adults may be sexually active and need close relationships. C. Most people become confused as they age. D. Older adults usually become depressed. The correct answer is older adults may be sexually active and need close relationships. Sexual needs and the desire for intimacy often continue throughout the lifespan. Question 24. Which action would be appropriate to meet a resident's safety and security needs? A. Encouraging the person to do as much for themselves as possible. B. Answering the person's requests for help promptly. C. Locking the person in their room. D. Providing the person with privacy when the person has visitors. The correct answer is answering the person's requests for help promptly. Knowing that help is available when needed creates a sense of security. Question 25. When you are the sender, what should you do after you deliver your message? A. Expect the person to do what you told them. B. Ask for confirmation that the message was understood. C. Communicate the next message. D. Look for written communication. The correct answer is ask for confirmation that the message was understood. Seeking feedback ensures the communication was effective and understood. Question 26. When entering the room of a person who is blind, you should A. Walk up quietly and touch the person on the back. B. Knock on the door, wait for a response and introduce yourself. C. Knock on the door and go in. D. Talk in a low voice. The correct answer is knock on the door, wait for a response and introduce yourself. Verbal introduction prevents startling a person who cannot see you enter. Question 27. Mrs. James is deaf. What can you do to make sure she understands the information? A. Get help from a translator. B. Write the information down for her. C. Speak in the loudest voice possible. D. All of the above. The correct answer is write the information down for her. Writing provides a visual method of communication to ensure understanding. Question 28. Mrs. Morgan's daughter seems critical of your care. What is the best way to handle this? A. Ask Mrs. Morgan to tell her daughter she likes the care. B. Tell the daughter her mother likes the care. C. Tell the daughter your way is the only way. D. Explain what you are doing and ask her what measures she found effective. The correct answer is explain what you are doing and ask her what measures she found effective. Engaging the family and validating their knowledge builds trust and teamwork. Question 29. Mrs. Lewis is diabetic but wants to fast for religious reasons. You could A. Tell her she shouldn't feel bad. B. Avoid talking about religion. C. Tell her she doesn't have to eat. D. Tell her you understand it feels strange to eat and encourage her to talk about it. The correct answer is tell her you understand it feels strange to eat and encourage her to talk about it. Acknowledging the conflict shows empathy and respect for spiritual beliefs. Question 30. Which of the following is subjective information? A. Mrs. Lyons tells you she feels sick to her stomach. B. Mr. Upton has a red sore forming on his big toe. C. Mr. Halliday's blood pressure is 130/90. D. Mrs. Harper ate only 50% of her meal. The correct answer is Mrs. Lyons tells you she feels sick to her stomach. Subjective information is what the patient tells you, symptoms. Objective is what you observe or measure. Question 31. Which observation should you report to the nurse? A. Mrs. Zimmer is having difficulty having a bowel movement. B. Mr. Thomas does not seem like himself today. C. Mrs. Nolan does not want to attend the group activity. D. All of the above. The correct answer is all of the above. Physical, mental, and behavioral changes should all be reported. Question 32. Which document details the care the person requires? A. The electronic medical record. B. The nursing notes. C. The flow sheet. D. The care plan. The correct answer is the care plan. The care plan acts as the daily roadmap for providing specific patient care. Question 33. It is 2 o'clock in the afternoon. How would you express this using the 24-hour clock? A. 2 p.m. B. 0200 C. 1400 D. 2 a.m. The correct answer is 1400. Add 12 to p.m. hours. 2 plus 12 equals 1400. Question 34. Why is it important to record care and observations accurately? A. The medical record is a legal record. B. The team relies on it for decisions. C. Reimbursement depends on it. D. All of the above. The correct answer is all of the above. Documentation serves legal, clinical, and financial purposes. Question 35. When you take dirty linens to the laundry hamper, you should A. Shake them first. B. Hold them away from your uniform. C. Take only one sheet at a time. D. Toss them into the hamper from a distance. The correct answer is hold them away from your uniform. Holding linens away prevents contamination of your uniform. Question 36. What is the most important thing you can do to control the spread of microbes? A. Bag all contaminated linens. B. Wash your hands. C. Cover bedpans. D. Eat a well-balanced diet. The correct answer is wash your hands. Hand hygiene is the single most effective way to prevent infection. Question 37. You should practice standard precautions. A. When you provide care for any person. B. Only for people with HIV or HBV. C. Only when a person is in isolation. D. Only when you need to wash your hands. The correct answer is when you provide care for any person. Standard precautions apply to all patients, regardless of diagnosis. Question 38. What is one time when you must wear gloves? A. When you give a back rub. B. When you cough or sneeze. C. When you serve meal trays. D. When you touch blood or other body fluids. The correct answer is when you touch blood or other body fluids. Gloves are required whenever there is potential contact with bodily fluids. Question 39. If you have a cut on your hand, what must you do to protect yourself and others? A. Avoid providing care. B. Stay away from work. C. Wear gloves while providing care. D. Handle only clean items. The correct answer is wear gloves while providing care. Covering the wound and wearing gloves prevents transmission of infection. Question 40. Which of the following is a reason to place someone in isolation? A. The person has a contagious disease. B. The person had surgery. C. The person is demanding. D. The person wants privacy. The correct answer is the person has a contagious disease. Isolation precautions are used to stop the spread of contagious pathogens. Question 41. Which of the following is part of good body mechanics? A. Independence. B. A communication. C. Entrapment. D. Alignment. The correct answer is alignment. Proper alignment reduces strain on the body during movement. Question 42. Which of the following moves increases your stability? A. Moving your feet close together. B. Bending at the waist. C. Spreading your feet apart. D. Relaxing your stomach muscles. The correct answer is spreading your feet apart. A wide base of support improves balance and stability. Question 43. Before using any equipment, you should A. Check to make sure it is working properly. B. Unplug it. C. File an incident report. D. Stand up straight. The correct answer is check to make sure it is working properly. Ensuring equipment is functional prevents injury to the patient and staff. Question 44. Mrs. Singer has lost feeling in her legs due to diabetes. She is at high risk for A. Poisoning. B. Burns. C. Entrapment. D. Electrical shock. The correct answer is burns. Neuropathy prevents the sensation of heat, making burns from water or heating pads a high risk. Question 45. All of the following are risk factors for falling except A. Poor eyesight. B. Regular exercise. C. Poor mobility. D. Medication effects. The correct answer is regular exercise. Regular exercise improves strength and balance, reducing fall risk. Question 46. You are not familiar with the mechanical lift in the facility. What should you do? A. Use it anyway. B. Task the nurse or another nurse assistant to show you how to use the lift. C. Do not use the lift. D. Practice on another resident. The correct answer is ask the nurse or another nurse assistant to show you how to use the lift. Never use equipment you have not been trained on, ask for help. Question 47. All of the following are potential complications of restraints except A. Death. B. Low self-esteem and depression. C. Nerve and tissue damage. D. Drowning. The correct answer is drowning. Drowning is not a standard risk of restraints, strangulation and trauma are. Question 48. Before applying a restraint, you must make sure of all of the following except A. Mrs. Schneider is able to remove the device independently. B. The doctor has written an order. C. Mrs. Schneider understands the reason. D. You have been properly trained. The correct answer is Mrs. Schneider is able to remove the device independently. If the patient can remove the device, it is considered an enabler, not a restraint. Question 49. Restraints must be released at least A. Every shift, B. Every hour, C. Every 2 hours, D. Whenever a relative visits. The correct answer is every hour. Restraints must be released periodically to check skin and allow movement. Facility policies vary, but frequent checks are mandatory. Question 50. What does it mean to force fluids? A. Force a person to drink. B. Encourage a person to drink as much fluid as possible. C. Encourage a person to urinate. D. Offer strong fluids. The correct answer is encourage a person to drink as much fluid as possible. Force fluids is a medical order to encourage increased hydration. Question 51. Which of the following may be ordered for a person with kidney disease? A. Full liquid diet. B. Sodium restricted diet. C. Thicken liquids. D. Soft diet. The correct answer is sodium restricted diet. Kidneys filter sodium. Damaged kidneys require low sodium to prevent fluid retention. Question 52. A resident is receiving nutrition through a G-tube. You should A. Keep the resident flat. B. Give the resident water by mouth. C. Clean with alcohol. D. Keep the head of the bed elevated for 30 minutes following a tube feeding. The correct answer is keep the head of the bed elevated for 30 minutes following a tube feeding. Elevating the head prevents aspiration of stomach contents. Question 53. People who do not drink enough liquids can experience A. Dehydration, B. Nausea, C. Loss of hearing, D. Diarrhea. The correct answer is dehydration. Insufficient fluid intake leads to dehydration. Question 54. When serving meals to people with paraplegia or paralysis, A. Place the tray far away. B. Sit closest to the person's affected side. C. Make sure the person is supine. D. Encourage the person to eat in private. The correct answer is sit closest to the person's affected side. Sitting on the affected side allows the aide to assist while the patient uses their strong side. Question 55. When emptying an ostomy appliance, you should A. Raise the head of the bed. B. Place the bottom opening of the ostomy in a bedpan before opening the clip. C. Rinse with hot water. D. Place deodorant in the appliance. The correct answer is place the bottom opening of the ostomy in a bedpan before opening the clip. Using a bedpan catches the contents and prevents spillage. Question 56. What is the term for the inability to control bowel movements and or urine elimination? A. Incontinence. B. Dehydration. C. Diarrhea. D. Constipation. The correct answer is incontinence. Incontinence is the lack of voluntary control over urination or defecation. Question 57. Which statement about elimination is true? A. Only fully mobile people need privacy. B. The person will be able to control elimination better if they are helped to the bathroom promptly. C. People should be required to use the toilet on a schedule. D. Residents will not be embarrassed. The correct answer is a person will be able to control elimination better if they are helped to the bathroom promptly. Prompt assistance prevents accidents and maintains continence. Question 58. You observe that a resident has not had a bowel movement in 3 days. What should you do? A. Give an enema. B. Encourage rest. C. Nothing. D. Report the change in bowel elimination pattern to the nurse. The correct answer is report the change in bowel elimination pattern to the nurse. Prolonged absence of bowel movement can indicate constipation or impaction. Question 59. How often should a person's incontinence pad or briefs be changed? A. When you detect an odor. B. Whenever they become soiled. C. At the end of the shift. D. Every hour. The correct answer is whenever they become soiled. Immediate changing prevents skin breakdown and infection. Question 60. The nurse asks you to obtain a midstream, clean catch, urine specimen. What should you do? A. Collect 24-hour urine. B. Empty bedpan into container. C. Remind the person to start, stop, then collect urine. D. Provide catheter care. The correct answer is remind the person to start, stop, then collect urine. The midstream technique flushes bacteria from the urethra for a cleaner sample. Question 61. Which piece of equipment would be best to use to obtain a urine specimen from Mrs. Klein, who uses the toilet? A. A bottle. B. A urinal. C. A commode hat. D. A bedpan. The correct answer is a commode hat. A commode hat fits in the toilet bowl to catch urine. Question 62. A resident with arthritis complains of pain. You should A. Medicate the patient. B. Report the complaint of pain to your supervising nurse. C. Exercise the joints vigorously. D. Apply a heating pad. The correct answer is report the complaint of pain to your supervising nurse. CNAs must report pain to the nurse for assessment and medication. Question 63. Which pain report has the most helpful information? A. He has pain in both feet. B. He has constant complaints of pins and needles in his feet, which makes it hard for him to walk. C. He is having a hard time walking. D. He says his feet feel funny. The correct answer is he has constant complaints of pins and needles in his feet, which makes it hard for him to walk. Specific descriptions of the pain sensation and its impact on function are most useful. Question 64. When a person with cognitive changes experiences pain, A. They may not be able to find words. B. They may be preoccupied by pain. C. They may recall past pain. D. All of the above. The correct answer is all of the above. Cognitive impairment complicates pain perception and communication. Question 65. Which is true of chronic pain? A. It lasts less than 6 months. B. Older people often have at least one condition that causes chronic pain. C. It is related to surgery. D. Nothing can be done. The correct answer is older people often have at least one condition that causes chronic pain. Chronic conditions like arthritis are common causes of pain in the elderly. Question 66. What is the purpose of the pain scale? A. To locate pain. B. To time pain. C. To describe characteristics. D. To help a person communicate their level of pain. The correct answer is to help a person communicate their level of pain. Pain scales quantify the intensity of the pain. Question 67. What is the purpose of a scheduled toileting program for a person with dementia? A. Punishment. B. Teaching. C. To give the opportunity for elimination just before the person would normally void to reduce incontinence. D. Reduce nurse workload. The correct answer is to give the opportunity for elimination just before the person would normally void to reduce incontinence. Timed voiding prevents accidents by anticipating the need to go. Question 68. Mrs. Summers is weak but can sit up. What equipment is best for elimination? A. Bedpan. B. A toilet seat, portable commode. D. Catheter. The correct answer is portable commode. A portable commode near the bed accommodates weakness while allowing a seated position. Question 69. Which of the following could increase a person's risk for developing a UTI? A. Not drinking enough water. B. Not emptying bladder completely. C. Indwelling catheter. D. All of the above. The correct answer is all of the above. Stagnant urine and foreign objects, catheters, promote bacterial growth. Question 70. Mrs. Cummings has an indwelling urinary catheter. You should A. Remove the catheter for care. B. Secure tubing to side rail. C. Make sure the tubing and urine drainage bag are lower than Mrs. Cummings' bladder. D. Disconnect the bag to empty. The correct answer is make sure the tubing and urine drainage bag are lower than Mrs. Cummings' bladder. Keeping the bag lower than the bladder prevents urine backflow and infection. Question 71. When is an ostomy appliance used? A. Incontinence. B. Stool sample. C. When a person has had the bladder or a portion of the bowel surgically removed. D. Surgery prep. The correct answer is when a person has had the bladder or a portion of the bowel surgically removed. Ostomies collect waste from a surgically created stoma. Question 72. Mrs. Ito needs help transferring but can use the toilet. You should A. Make sure the toilet paper and call signal are within her reach, and then leave her alone, checking frequently. B. Stay in the bathroom. C. Encourage bedpan use. D. Encourage commode use. The correct answer is make sure the toilet paper and call signal are within her reach, and then leave her alone, checking frequently. Providing privacy is important for dignity if safety can be maintained. Question 73. Which nutrient helps the body build and repair tissue? A. Carbohydrates. B. Fat. C. Protein. D. Water. The correct answer is protein. Protein is essential for growth and repair of body tissues. Question 74. A healthy diet is one that A. The person will eat. B. Emphasizes whole grains, fruits and vegetables, lean meats and low-fat dairy. C. The provider prescribes. D. The person grew up eating. The correct answer is emphasizes whole grains, fruits and vegetables, lean meats and low-fat dairy. A balanced diet includes all food groups in appropriate proportions. Question 75. Which nutrient supplies the body with its most basic form of energy? A. Carbohydrates. B. Vitamins and minerals. C. Protein. D. Fat. The correct answer is carbohydrates. Carbohydrates are the body's primary energy source. Question 76. All of the following can affect food choices except A. The person's height. B. The person's culture. C. The person's religious beliefs. D. The person's ability to prepare food. The correct answer is the person's height. Height does not dictate food preferences or choices. Question 77. Mrs. Powell has little appetite due to grief. What action encourages eating? A. Remind her she could get sick. B. Sit with Mrs. Powell while she is eating and make pleasant conversation. C. Explain my plate. D. Threaten no dessert. The correct answer is sit with Mrs. Powell while she is eating and make pleasant conversation. Social interaction can improve mood and appetite. Question 78. All of the following can affect a person's appetite except A. Medications, B. Inability to smell, C. Pain, D. The person's fluid balance. The correct answer is the person's fluid balance. While severe dehydration affects health, daily appetite is more directly impacted by pain, smell, and meds. Question 79. Which therapeutic diet might be ordered for a person who has trouble chewing or swallowing? A. Carbohydrate controlled, B. Liquid, C. A soft, mechanical, or pureed diet, D. High protein. The correct answer is soft, mechanical, or pureed diet. Modifying food texture makes it safe to chew and swallow. Question 80. Mrs. Johnson refuses her meal supplement. What should you do? A. Report Mrs. Johnson's refusal of the shake to the nurse. B. Return it to the fridge. C. Record but do not report. D. Nothing. The correct answer is report Mrs. Johnson's refusal of the shake to the nurse. Refusal of ordered nutrition must be reported for monitoring. Question 81. Which of the following should you do when feeding a person who cannot see? A. Tell the person loudly what you are feeding. B. Orient the person to the location of items using the clock face method. C. Insist on a bid. D. Thicken liquids. The correct answer is orient the person to the location of items using the clock face method. The clock method promotes independence by describing food location. Question 82. Mr. Singer drinks 8 ounces milk, 240 ml, 180 ml juice, 120 ml coffee. Total? A. 308 ml, B. 300 ml, C. 540 ml, D. 18 ml. The correct answer is 540 ml. 240 plus 180 plus 120 equals 540 ml. Question 83. Which of the following is a sign of dehydration? A. A swelling, B. A frequent urination, C. Loss of appetite, D. Confusion. The correct answer is confusion. Electrolyte imbalance from dehydration often causes confusion in the elderly. Question 84. What should you do if a fire alarm sounds? A. Leave. B. Task another CNA. C. Follow your employer's policies for responding to a fire alarm. D. Ignore it. The correct answer is follow your employer's policies for responding to a fire alarm. Always follow the facility's emergency protocol, example race. Question 85. Which of the following could be a sign of a stroke? A. A sweating, B. Convulsions, C. Fainting, D. A drooping on one side of the face. The correct answer is drooping on one side of the face. Facial drooping is a classic sign of a stroke, fast. Question 86. Mr. Cooperstone is choking and making a high-pitched wheezing sound. What should you do? A. CPR, B. Call for help immediately, and then begin administering back blows and abdominal thrusts. C. Watch him. D. Reassure him. The correct answer is call for help immediately, and then begin administering back blows and abdominal thrusts. Immediate intervention is needed for an obstructed airway. Question 87. A resident loses consciousness. What should you do first? A. Call for help immediately. B. Splash water. C. Move furniture. D. CPR. The correct answer is call for help immediately. The first step in an emergency is to call for help. Question 88. How should you position a person who is having a seizure? A. Flat on back. B. On the person's side. C. Seated. D. On stomach. The correct answer is on the person's side. Side-lying position keeps the airway clear and prevents aspiration. Question 89. A coworker has cut herself and is bleeding. First step: A. Call 911. B. Put on a pair of gloves and then go to her aid. C. Apply pressure. D. Rinse with water. The correct answer is put on a pair of gloves and then go to her aid. Protect yourself from blood-borne pathogens before assisting. Question 90. Tornado watch issued. Best place for home health client? A. Dining room. B. A windowless bathroom on the ground floor. C. Client's room. D. A front hall. The correct answer is a windowless bathroom on the ground floor. Interior rooms without windows offer the best protection from debris. Question 91. Which of the following could be a sign of a myocardial infarction? A. Blurred vision. B. Nausea. C. Aura. D. Shock. The correct answer is nausea. Nausea is a common symptom of a heart attack, especially in women and the elderly. Question 92. Temperature, pulse, respirations, and blood pressure are referred to as A. Life measurements. B. Vital signs. C. Routine measurements. D. Monitoring. The correct answer is vital signs. Vital signs provide critical information about basic body functions. Question 93. Mrs. Tyler has just been admitted. What measurements will you obtain? A. BP, temp, RESP, pulse. B. Height. C. Weight. D. All of the above. The correct answer is all of the above. Baseline measurements of all vital signs and anthropometrics are needed on admission. Question 94. What instrument is used to listen to sounds for BP or apical pulse? A. A stethoscope. B. A diaphragm. C. A sphygmomanometer. D. A thermometer. The correct answer is stethoscope. A stethoscope is used to auscultate internal body sounds. Question 95. Mr. Rollins is receiving oxygen therapy. Avoid which temp method? A. Oral method. B. Axillary method. C. Rectal method. D. Tympanic method. The correct answer is oral method. Oxygen administration cools the mouth, making oral temperatures inaccurate. Question 96. Which measurement is outside the normal range for an adult? A. Temp 99 F. B. Respirations, 10 breaths / min. C. Pulse 63 D. BP 107/70. The correct answer is respirations, 10 breaths / min. Normal respirations are 12 to 20. 10 is too slow, bradypnea. Question 97. Where is the brachial pulse located? A. The inside of the elbow. B. Top of heart. C. Or wrist. D. Groin. The correct answer is the inside of the elbow. The brachial pulse is felt in the antecubital fossa, inner elbow. Question 98. What equipment is needed to measure a radial pulse? A. A sphygmomanometer. B. Stethoscope. C. Watch with a second hand. D. All of the above. The correct answer is watch with a second hand. A watch is needed to count the beats per minute. Question 99. Mrs. Wilson's pulse is very weak. How would you describe it? A. Shallow. B. Thready. C. Bounding. D. Irregular. The correct answer is thready. Thready describes a weak, difficult to feel pulse. Question 100. Which of the following factors can affect vital sign measurements? A. Illness. B. Emotions. C. Time of day. D. All of the above. The correct answer is all of the above. Vital signs fluctuate based on physical and emotional states. Question 101. The nurse asks you to measure the level of oxygen in blood. Use A. Tympanic thermometer. B. Stethoscope. C. A sphygmomanometer. D. Pulse oximeter. The correct answer is pulse oximeter. A pulse oximeter measures oxygen saturation, SpO2. Question 102. What is the first sign of a pressure injury? A. Reddened area on the skin. B. Fever. C. Open sore. D. Bleeding. The correct answer is A. Reddened area on the skin. Non-blanchable redness is a stage 1 pressure injury. Question 103. To avoid damaging the skin, reposition a person A. Whenever. B. Every 4 hours. C. According to the schedule in the person's care plan. D. Start/end of shift. The correct answer is according to the schedule in the person's care plan. Care plans dictate specific turning schedules, usually at least every 2 hours. Question 104. Assisting people with bathing, eating, walking, and dressing are A. Principles of care. B. Routine activities. C. Activities of daily living. D. Physical activities. The correct answer is activities of daily living. ADLS are fundamental skills required to care for oneself. Question 105. What term best describes the loss of mental abilities? A. Mental affect impairment. B. Cognitive mental impairment. C. Cognition impairment. D. Cognitive impairment. The correct answer is cognitive impairment. Cognitive impairment covers memory loss, confusion, and loss of reasoning. Question 106. Which of the following are not one of the 6 principles of care? A. Communication. B. Safety. C. Rights. D. Independence. The correct answer is rights. While rights are crucial, they are usually separate from the specific 6 principles framework. Question 107. To protect yourself and the person, always work within your A. Scope of practice. B. Work practice scope. C. Best working practice. D. Scope of working practice. The correct answer is scope of practice. Scope of practice defines the legal limits of what you can and cannot do. Question 108. Threatening a person with physical harm is what type of abuse? A. Sexual abuse. B. Emotional abuse. C. Neglect. D. Financial abuse. The correct answer is emotional abuse. Intimidation and threats fall under emotional/psychological abuse. Question 109. Taking care to secure tools used for documentation is a part of what legislation? A. Probability Act. B. Health Insurance Portability and Accountability Act. C. Portance Act. D. Protections Act. The correct answer is Health Insurance Portability and Accountability Act. HIPAA governs the security and privacy of health information. Question 110. The legal document that gives decision-making responsibility to someone else? A. Durable power of attorney. B. Living will. C. Advanced directive. D. Living trust. The correct answer is durable power of attorney. A durable power of attorney appoints a proxy for healthcare decisions. Question 111. It is acceptable for a CNA to accept money or gifts. A. True. B. False. The correct answer is false. Accepting gifts is unprofessional and often violates facility ethics policies. Question 112. Which of the following is not a characteristic of professional behavior? A. Being courteous. B. Being accountable. C. Being unhelpful. D. Being dependable. The correct answer is being unhelpful. Professionalism implies competence and helpfulness. Question 113. Non-maleficence is defined as A. Fair treatment. B. The concept of avoiding harm or hurt. C. Behaving right. D. Desire to do good. The correct answer is the concept of avoiding harm or hurt. Non-maleficence means do no harm. Question 114. A situation with more than one good or moral solution is A. Ethical moral. B. Moral decision. C. Ethical dilemma. D. Ethical integrity. The correct answer is ethical dilemma. An ethical dilemma occurs when there are conflicting moral choices. Question 115. What are the ethical principles relevant to healthcare? A. Justice, fidelity. B. Autonomy, justice, beneficence, non-maleficence, fidelity. C. Fidelity, courtesy. D. Dependability. The correct answer is autonomy, justice, beneficence, non-maleficence, fidelity. These are the 5 core ethical principles in healthcare.